Encouraging in recent weeks, but there is still a spark of good news. The recent milestone of 10 million COVID-19 vaccines administered is good news. However, the elevated case counts and the severe illness trends remind us we're still in a tight race between vaccines and the variants, and that our actions matter. The total number of cumulative cases of COVID-19 now exceeds 1.15 million cases, which is an increase of more than 200,000 cases since the last modeling update a month ago.
Slide 1. National disease and severe indicators have increased considerably over the past month. Average case counts are now more than double what they were a month ago, with over 8,400 cases being reported daily over the past week. Likewise, the average number of people in our hospitals and ICUs each day has doubled or more since late March. Over the past week, an average of over 4,100 people with COVID-19 were being treated in our hospitals each day, including over 1,200 in critical care. The number of daily reported deaths remains well below the peaks during the first and second waves, but has increased recently, with an average of 46 deaths being reported daily over the past week. Hold on, the spark of good news is coming.
Diapositive 1. Les indicateurs nationaux des maladies et des sévérités ont considérablement
Slide 1.
augmenté.
Indicators of illness and severity have increased over the past year. The number of cases now is twice as high as last month, with more than 8,400 cases being reported daily over the past week. The number of people in our hospitals and in ICUs each day has doubled or more since late March. Last week, on average, more than 4,100 people with COVID-19 were being treated in our hospitals, including 1,200 in critical care. The number of daily reported deaths remains well below the peaks during the first and second wave, but it recently increased with an average of 46 deaths being reported daily over the past week. But now let's come to the good news.
Recall that the time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each new case infects less than one person, the epidemic will die out. Nationally, the RT had been trending above 1 since early March, meaning every 100 cases in Canada will pass the virus to more than 100 others, and so on, rapidly increasing the size of the epidemic with each generation of spread. But here's the spark of good news. In recent days, following the implementation of restrictions in heavily impacted areas of Canada, the national RT has finally dipped below 1. This means that for the first time in many weeks, the epidemic has dropped out of a growth pattern, primarily driven by recent declines in epidemic growth in Ontario, Quebec, and British Columbia. However, RT is still at above 1 in other areas of Canada and needs to be maintained consistently below 1 to bring the epidemic under lasting control. So we have reassurance that strengthened measures can slow growth where more contagious variants are circulating. The sustained measures and individual practices is the key to driving and keeping growth down.
Diapositive 2.
Slide 2. We have to remember that the time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each case infects less than one person, the epidemic will die out. Nationally, the RT had been trending above 1 since early March, meaning that every 100 cases in Canada were passing the virus to more than 100 others, and so on, rapidly increasing the size of the epidemic with each generation of spread. But there is good news. In recent days, after the implementation of restrictions in heavily impacted areas of Canada, the national RT has finally dipped below 1. This means that for the first time in many weeks, the epidemic has dropped out of a growth pattern, primarily driven by recent declines in epidemic growth in Ontario, Quebec, and British Columbia. However, the RT is still above 1 or at 1 in other areas of Canada and needs to be maintained consistently below 1 to bring the epidemic under lasting control. So we have reassurance that strengthened measures can slow growth where more contagious variants are circulating, but sustaining measures and individual practices is key to driving and keeping growth down.
Slide 3. Rapidly spreading COVID-19 virus variants of concern, or VOCs, have appeared in all provinces and 2 territories with over 78,000 VOC cases reported to date. The B117 variant has accounted for over 95% of these to date and is predominating in several areas. However, more recently, there has been a concerning rise in P1 cases. Reported VOCs represent the tip of the iceberg, as there are many more COVID-19 cases that have screened positive for mutations indicative of VOCs. Nevertheless, more contagious variants present a risk everywhere in the country. More contagious variants like B117 can result in a rapid spike of cases, whereas vaccines may be less effective against variants like B1351 and P1. Controlling infection rates is needed in heavily affected areas. Elsewhere, ongoing vigilance is necessary to monitor, screen, and rapidly respond to any rising cases to stop a variant of concern in its tracks. Early, strong, and sustained community-based public health measures and consistent adherence to individual practices work best to slow growth, prevent spread into new areas, or eliminate transmission from an area.
Diapositive 3.
Slide 3. Variants of concern, or VOCs, of the COVID-19 virus have appeared in all provinces and 2 territories, with over 78,000 cases of variants of concern reported to date. The B.1.1.7 variant has accounted for over 95% of these to date and is predominating in several areas. However, more recently, there has been a concerning rise in P.1 variant cases. The VOCs reported represent only the tip of the iceberg, as there are many more COVID-19 cases that have screened positive for problematic mutations. However, more contagious variants present a risk everywhere in the country. More contagious variants like B.1.7 can result in a rapid spike of cases, whereas vaccines may be less effective against variants like B.1.351 and P.1. Controlling infection rates is needed in heavily affected areas. Elsewhere, ongoing vigilance is necessary to monitor, screen, and rapidly respond to any rise in cases to stop a variant of concern in its track. Early, strong, and sustained community-based public health measures and consistent adherence to individual practices work best to slow growth, to prevent spread into new areas, or eliminate transmission from an area.
Slide 4. COVID-19 hospitalization rates are increasing in provinces with sustained high levels of disease activity. On average, the length of stay of people hospitalized is about 2 weeks, or close to 3 weeks for those experiencing more severe illness. This means that the number of patients being treated in hospital with COVID-19 continues to accumulate over time, placing a prolonged and heavy strain on the health system. Many intensive care units are operating at, near, or even over capacity. As a result, many patients are being transferred to other hospitals. In many regions, hospitals have been forced to postpone or cancel non-urgent surgeries and procedures. For example, this week, Ontario issued a directive to immediately halt all non-emergent surgeries or non-urgent procedures.
Diapositive 4. Les taux
Slide
d'hospitalisation
4.
attribuables à la COVID-19 augmentent dans les
COVID-19
provinces où la sévérité
hospitalization
de la
rates
maladie
are
demeure
increasing in
élevée.
provinces with
En
sustained high
moyenne, la
levels
durée
of
de
disease
séjour des
activity.
personnes
On
hospitalisées
average, the
est
length of
d'environ
stay
deux
for people
semaines et de
hospitalized is
2 à
about
3
2 weeks,
semaines pour les
or
personnes
close to
atteintes
3 weeks
d'une
for
maladie
those
plus grave.
experiencing more severe
Cela
illness.
signifie que le nombre de
This means
patients
that the number
traités
of
à l'hôpital
patients
atteints de
being
la
treated in
COVID-19
hospital with
continue de s'accumuler
COVID-19
au fil du temps,
continues to
ce
accumulate
qui
over
alourdit
time,
et prolonge le
placing a
fardeau des
prolonged
systèmes de
and heavy
santé.
strain on the
Plusieurs
healthcare
unités de
system.
soins intensifs
Many
opèrent
intensive care
presque au
units are
maximum de leur
operating
capacité
at,
ou
near, or
au-delà de
even
leur
over
capacité.
capacity.
Plusieurs patients ont donc dû
As a
être
result,
transférés vers
many
d'autres
patients
hôpitaux.
are being
Dans plusieurs
transferred to
régions,
other
plusieurs hôpitaux
hospitals.
ont dû
In many
repousser
regions,
ou annuler
hospitals
des
have been
chirurgies
forced to
et des
postpone or
interventions
cancel
non urgentes.
non-urgent
Par
surgeries and
exemple, cette
procedures.
semaine,
For example,
l'Ontario a
this week,
émis une directive
Ontario
demandant
issued
de
a
cesser
directive
immédiatement toutes les
to
chirurgies
immediately
et
halt all
interventions non urgentes.
non-emergency surgeries and non-urgent procedures.
Slide 5. While hospitalizations are increasing across all adult age groups, the steepest rise in the average number of cases hospitalized for severe COVID-19 related illness is being observed among adults aged 40 to 59 years of age. This is a reminder that although severe illness is less common in younger age groups, serious or prolonged illness can occur at any age, and there are emerging concerns about increased severity of the B117 variant in adults.
Diapositive 5.
Slide 5. Even though the hospitalization rate
la plus
increases
forte des cas
across
hospitalisés
all
pour les
adult
cas graves
age
de
groups,
COVID-19
the
est
steepest
donc
rise
située
in the
chez
average
les
number of
adultes
cases
âgés de
hospitalized for
40
severe
à
COVID-19
59
related
ans.
illness is being
Vous
observed
savez, la
among
règle
adults
rappelle que bien
aged
que le cas
40 to
grave de la
59.
maladie soit moins courant chez les
This is
groupes
a
d'âge
reminder
plus
that
jeunes,
although
le
severe illness is
formulaire
less common in younger
COVID-19
age
peut se
groups,
présenter à
a
tout
serious
âge
or
très
prolonged illness
sévère
can
et
occur at
accueille des
any
cas
age,
du
and there
variant
are emerging
B117
concerns
chez
about
les
the
adultes
increased
et de
severity
plus
of
en
the
plus chez leurs enfants.
B.1.1.7 variant in adults.
Slide 6. Overall, more than 11 million doses of COVID-19 vaccines have been administered since vaccination began in mid-December, providing 30% of Canadian adults with at least one dose of COVID-19 vaccine. Notably, Indigenous communities and the territories have made excellent strides in increasing vaccination coverage, demonstrating strong leadership in the administration of vaccine programs in these communities. To date, more than 2/3 of adults in the 3 territories have received at least one dose of COVID-19 vaccine, and more than half of adults have received 2 doses.
Diapositive 6.
Slide 6.
Plus de 11
Overall,
millions de doses de vaccins
more than
contre la
11
COVID-19
million
ont
doses
été
of
administrés depuis le
COVID-19
début de la
vaccines have
vaccination
been
à la
administered
mi-décembre.
since
30%
vaccination
des adultes
began in
canadiens
mid-December,
ont maintenant reçu
providing
au moins une
30%
dose
of
de
Canadian
vaccin contre
adults
la
with at least
COVID-19.
one dose of
À noter que
COVID-19
les
vaccine.
collectivités autochtones et les
Notably,
territoires ont fait
Indigenous
d'excellents
communities and
progrès
the
pour
territories have
augmenter la
made
couverture
excellent
vaccinale,
progress in
démontrant
increasing
une solide
vaccination
leadership
coverage,
en ce qui concerne la
demonstrating
gestion des
strong
programmes de
leadership in the
vaccination dans
administration of
ces
vaccination
collectivités.
programs in these
Jusqu'à présent,
communities.
plus de 2/3 des adultes
To
dans les
date,
3
more than
territoires ont
2/3 of
reçu au moins
adults in
une
the
dose
3
d'un vaccin
territories
contre la
have received at
COVID-19
least
et
one
plus de la
dose of
moitié des adultes
COVID-19
ont reçu
vaccine,
2
and more
doses.
than half of adults have received 2 doses.
Slide 7. Over 86% of adults aged 80 years or older have received at least one dose of COVID-19 vaccine, which has contributed to reduced rates of infection in these high-risk age groups. Since early January, incidence rates have declined dramatically among adults aged 80 years and older, who were prioritized in the initial phases of the COVID-19 vaccine rollout. Likewise, outbreaks in long-term care homes have steadily declined since January.
Diapositive 7.
Slide
Plus de
7.
86%
Over
des adultes âgés de
86% of
80
adults
ans
aged
ou
80
plus ont
years
reçu au
or
moins
more
une dose de
have
vaccin contre
received
la
at least one
COVID-19,
dose of
ce qui a
COVID-19
contribué
vaccine,
à des taux
which has
réduits
contributed
d'infection
to
chez ces
reduced
groupes
rates of
d'âge à
infection
risque
in
élevé.
these
Depuis le
high-risk
début
age
du mois de
groups.
janvier,
Since early January, incidence rates have declined dramatically among adults aged 80 years and older who are prioritized in the initial phases of COVID-19 vaccine rollout. Likewise, outbreaks in long-term care homes have steadily declined since January.
Slide 8. High vaccine uptake in First Nations communities has contributed to a steady decline in active cases, as shown in this graph. In the territory, sustained strong public health measures while making excellent progress on vaccine coverage across the adult population reduces the risk of introduction and spread of COVID-19. A case of COVID-19 detected in Nunavut last Wednesday led to a rapid response and prompt implementation of community-based restrictions in both Iqaluit and Kingate, where additional cases have since been identified. At the same time, this week marked the official ending of an earlier outbreak in Arviat, demonstrating that strong and sustained measures can control or eliminate further spread.
Slide 8. High vaccine uptake in First Nations communities has contributed to a steady decline in active cases, as you can see in this graph. In the territories, sustaining strong public health measures while making excellent progress on vaccination coverage across the adult population reduces the risk of introduction and spread of COVID-19. A case of COVID-19 was detected in Nunavut last Wednesday and led to a rapid response and the prompt implementation of community-based restrictions in both Iqaluit and Kingate, where additional cases have since been identified. This week has also marked the official ending of an earlier outbreak in Arviat, demonstrating that strong and sustained measures can control or eliminate further spread.
Slide 9. Based on Canadian data up to April 17th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to May 2nd. The graph on the left shows the predicted number of cases could be in the range of 1,209,780 to 1,281,040 by May the 2nd. The graph on the right shows the predicted number of deaths could be in the range of 24,000 to 24,570 by May 2nd.
Slide 9. Based on Canadian data up to April 17th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to May 2nd. The graph on the left shows that the predicted number of cases could be in the range of 1,209,780 to 1,281,040 by May 2nd. The graph on the right shows that the predicted number of deaths could be in the range of 24,000 and 24,570 by May 2nd.
Slide 10. The March 26th long-range forecast predicted what could happen if more contagious variants continue to spread without implementing stronger public health measures and deterrence to individual precautions. During March and the beginning of April, surveillance data, the little red dots, showing cases reported after March the 26th forecast were plotting along the strong resurgence trajectory, demonstrating accuracy of the model and predicting that measures were not stringent enough to counter rapidly spreading variants of concern at that time. Since about mid-April, as restrictions in high incidence areas began to take effect, surveillance data points, the red dots towards the right of this graph, are plotting below the strong resurgence trajectory, indicating that these measures are starting to slow the spread. COVID-19 vaccines are beginning to help, but our efforts are crucial as rollout continues. Individual precautions are important everywhere, and where variants of concerns are surging, community-based measures, including restrictions, are needed to interrupt the rapid and risky spread.
Diapositive 10.
Slide
Les
10.
prévisions à long terme de 26 mars
The previous
prédisaient ce
longer-range
que pourrait se
modeling
produire si
forecasts
des
from
variants
March
plus contagieux
26 continue
continuaient de
to
se
play out in the
propager
data
sans la
that we
mise
are
en œuvre
seeing
de
now.
mesures de santé publique
The March
plus
26
rigoureuses
long-range
et sans le
forecast
respect des
predicted what could
précautions
happen if more
individuelles.
contagious variants continued to spread without
En mars et
implementing
au début
stronger
d'avril, les
public
données
health
de
measures
surveillance,
and
c'est le petit
adherence to
point rouge,
individual
montreront les
precautions.
cas
During
déclarés après
March
les
and at the beginning
prévisions
of
le
April,
26
surveillance
mars,
data, the
ont
red
retracé
dots,
la forte
showing cases
trajectoire de
reported after
résurgence
March
et ont
26
montré
forecast
l'exactitude du
were
modèle.
plotting
Ils
along the strong
prévoyaient que les
resurgence
mesures n'étaient pas
trajectory,
suffisamment
demonstrating the
rigoureuses
accuracy of the
pour
model
contrer
in
l'expansion
predicting that
rapide du
measures were
variant
not stringent
préoccupant
enough
à
to
ce
counter
moment-là.
rapidly spreading variants
Depuis
of
la
concern
mi-avril
at that
environ,
time.
alors que
Since
les
about
restrictions dans
mid-April,
les régions à forte
as
incidence ont
restrictions
commencé à
in
prendre
high
effet,
incidence
les
areas
premières
began to
données de
take effect,
surveillance, les points rouges à
surveillance
droite,
data
sont
points, the
tracés
red
sous
dots to the
la
right,
forte
are
trajectoire de
plotting below
résurgence,
the
ce
strong
qui indique
resurgence
que ces mesures
trajectory,
commencent à
indicating
ralentir
that
la
these measures
propagation.
are starting to
Le
slow the
vaccin contre
spread.
la COVID-19 commence
COVID-19
à aider,
vaccines
mais
are
nos
beginning to
efforts sont
help,
cruciaux
but
alors
our
que le
efforts are
déploiement se
crucial
poursuit.
as the
Les
rollout
précautions
continues.
individuelles sont
Individual
importantes
precautions
partout
are
et
important
là où les
everywhere,
variants préoccupants
and
sont
where
à la
variants
hausse,
of
des
concerns are
mesures
surging,
communautaires, y compris des
community-based measures,
restrictions, sont
including
nécessaires pour
restrictions,
interrompre
are
leur
necessary to
propagation
interrupt
rapide
their
et
rapid
risquée.
and risky spread.
Slide 11. In addition to accounting for more rapidly spreading variants, the updated forecast also accounts for the impact of vaccination. This updated longer range forecast model predicts that if heavily impacted areas had done nothing to strengthen public health measures, cases would continue to surge along that gray line. But as jurisdictions have recently enhanced measures in heavily impacted areas, the model also explores the impact of these measures might have, depending on whether the measures are moderately or strongly effective in reducing in-person contact rates across the community. If implementation adherence to measures is moderately effective, reducing contact rates between people by 30%, the purple line, the epidemic is forecast to plateau at the current elevated level of activity, with hospitalizations and critical illnesses continuing to place a heavy strain across the healthcare system. However, if measures are strongly effective, reducing in-person contact rates across the community by 40%, as we observed in January, the epidemic is forecast to come under control, the blue line. The early effects of vaccination will help us achieve this reduction.
Diapositive 11.
Slide 11.
En plus de tenir compte des variants à propagation plus
In
rapide,
addition to
les
accounting
prévisions
for more
actualisées
rapidly
tiennent
spreading
également
variants,
compte de
the
l'effet de
updated
vaccination.
forecast also accounts
Avec
for
la
the impact of
propagation des variants
vaccination.
plus contagieux,
With more
ce modèle
contagious variants
prévision à plus
spreading,
long terme
this
mis à
updated
jour
longer-range
indique que
forecast
si
model
les régions
predicts
fortement
that
touchées
if heavily
n'avaient rien
impacted
fait pour
areas had
renforcer les
done
mesures de
nothing to
santé
strengthen
publique,
public
les
health
cas auraient
measures,
continué
cases
d'augmenter
would have
le long de
continued
la
to
ligne
surge
grise.
along the gray line.
Toutefois, comme les
But
administrations
as
ont récemment
jurisdictions
amélioré les
have
mesures dans
recently
les régions
enhanced
fortement
measures
touchées,
in
le modèle
heavily
explore
impacted areas,
également
the
l'incidence
model
que ces
also
mesures
explores the
pourraient avoir
impact these
selon que
measures
les
might
mesures
have,
sont modérément
depending on whether
et
the
fortement
measures are
efficaces pour
moderately
réduire les
or
taux de
strongly
contact en
effective in reducing
dans
in-person
l'ensemble de
contact
la
rates across
collectivité.
the community.
Si la mise en œuvre et le
If
respect des mesures sont
implementation and
modérément
adherence to measures is
efficaces, la
moderately
réduction
effective,
des taux de
reducing
contact
contact
entre les
rates
personnes de
between people by
30%, la ligne
30%, the
violette,
purple line,
l'épidémie devrait
the
se
epidemic is
stabiliser
forecast to
au niveau
plateau
actuel
at the
élevé
current
d'activité.
elevated
Les
level of activity,
hospitalisations et les
with
maladies graves
hospitalizations and critical
continueraient de
illnesses
mettre à
continuing to
rude
place
épreuve le
a heavy
système de soins de
strain
santé.
across the healthcare system.
Toutefois, si les mesures sont
However,
très efficaces,
if measures
en
are
réduisant
strongly
de
effective,
40% les taux de contact
reducing
aux
in-person
personnes dans la
contact rates across the
collectivité,
community by
comme nous l'avons
40%,
observé en
as we
janvier,
observed in January,
l'épidémie
the
devrait être
epidemic is
maîtrisée,
forecast to
ligne
come
bleue.
under control,
Les
the blue
premiers
line.
effets de la
The
vaccination
early
nous
effects of
aideront à
vaccination will
atteindre
help
cette
us
réduction.
achieve this reduction.
The experiences of other countries emphasizes the need to remain vigilant and maintain strong public health measures to control rapid spread of more contagious variants until vaccine rollout to a majority of the population. Even though over 60% of adults in the UK have received a first dose of COVID-19 vaccine, which provides significant protection, health authorities recognize that the second dose is crucial to protect people as much as possible. This is why the United Kingdom has maintained strong public health measures and has only recently begun a gradual lifting of restrictive measures. For example, face masks are still required in many settings. Indoor gatherings remain limited to just household members, and only outdoor dining is permitted. In contrast, over 60% of adult population in the United States has also received a first dose, but with less stringent public health measures in place in many areas, variants of concern have led to an uptick in case counts and hospitalizations. In heavily impacted areas of Canada, cautious and careful lifting of restrictive measures can happen safely once infection rates come down. But we will need to maintain vigilance everywhere until vaccines have rolled out across the Canadian population.
Diapositive 12.
Slide 12. The experiences of other countries emphasize the need to remain vigilant and maintain strong public health measures to control the rapid spread of more contagious variants until vaccines roll out to a majority of the population. Even though over 60% of adults in the UK have received a first dose of COVID-19 vaccine, which provides significant protection, health authorities recognize that the second dose is crucial to protect people as much as possible. This is why the United Kingdom has continued to maintain strong public health measures and has only recently begun a gradual lifting of restrictive measures. For example, face masks are still required in many settings. Indoor gatherings remain limited to just household members, and only outdoor dining is permitted. In contrast, over 60% of the adult population in the United States has also received a first dose. But with less stringent public health measures in place in many areas, variants of concern have led to an uptick in case counts and hospitalizations. In heavily impacted areas of Canada, a cautious and careful lifting of restrictive measures can happen safely once infection rates have come down. But we will need to remain vigilant everywhere until vaccines have rolled out across the Canadian population.
Slide 13. We're also undertaking more complex dynamic modeling that helps us explore what may happen in the coming months. The modeling shown here examines different scenarios for lifting restrictive public health measures based on the interplay of multiple factors, like vaccine effectiveness, vaccine rollout, and the impacts of variants of concern on epidemic growth and severe outcomes. Since one of our key concerns is whether the epidemic will threaten healthcare capacity, the scenarios on this slide show projections of hospitalized cases. That's the black line. Two scenarios shown, including one in which we could safely lift restrictions without overwhelming hospital capacity, that red dashed horizontal line, and another plausible alternative in which capacity could be overwhelmed. In both scenarios, measures are lifted, the vertical blue line, when 20% of Canadians have received their second dose. These models give us hope, illustrating that there is a safe way to lift most restrictive public health measures, like certain workplace and business closures, by this summer if enough people get vaccinated. In the plausible safe lifting scenario, that is on the left, if enough people get vaccinated, and assuming vaccine rollout proceeds as planned, by midsummer, at least 75% of adults aged 18 years and older will have received the first dose, and 20% will have received the second dose. At this point, restrictive measures could be gradually eased as long as adequate test, trace, isolate capacity, and individual precautions are maintained. The alternative, the figure on the right, assumes lower vaccine uptake. In this scenario, Only 55% of eligible adults are vaccinated with their first dose, and 20% with their second dose by mid-summer, despite the same supply and schedule of vaccine rollout as the previous scenario. In this case, lifting restrictions by midsummer would result in the epidemic resurging and overwhelming healthcare system capacity in the fall. This model demonstrates that achieving high vaccine uptake is crucial. The more people that get vaccinated, the safer it will be to lift restrictive public health measures. This is why it is so important to roll up our sleeves and get vaccinated.
Diapositive 13.
Slide 13.
Nous entreprenons également une
We are also
modélisation
undertaking
dynamique plus
a
complexe
more
qui nous aide
complex
à
dynamic
explorer ce
modeling
qui
that
pourrait se
helps us
produire
to
au cours des
explore
mois
what may
à venir.
happen in the
La
coming months.
modélisation présentée ici
The modeling
examine
shown
différents
here
scénarios
examines
pour lever les
different
mesures de santé
scenarios for the
publique
lifting
restrictives
of
fondées sur
restrictive public health
l'interaction des
measures
multiples
based on the
facteurs entre
interplay of
l'efficacité
multiple
du vaccin,
factors,
le
such as vaccine
déploiement du vaccin
effectiveness,
et les
vaccine rollout,
répercussions des
and the
variants
impacts of
préoccupants
variants of
sur la
concern
croissance
on
épidémique et les
epidemic
tendances
growth
des
and
résultats
severe
graves.
outcomes.
Comme l'une de nos principales
Since one of
préoccupations
our
est de
main
savoir si
concerns
l'épidémie
is
menacera la
whether the
capacité des soins de
epidemic will
santé,
threaten
les
healthcare
scénarios
capacity,
présentés sur
the
cette
scenarios
diapositive
shown on this
montrent des
slide show
projections
projections
liées
of
à
hospitalized
l'hospitalisation.
cases.
C'est la ligne
That's the
ondulée
black
noire.
wavy line.
Un des scénarios illustre que quand nous pourrons lever les restrictions
One
sans
of the
excéder la
scenarios
capacité
shows
des hôpitaux, c'est cette ligne,
when
les lignes
we
pointillées
could
rouges,
safely lift
tandis que
restrictions
l'autre
without overwhelming
illustre un
hospital
autre scénario
capacity, the red
plausible
dashed
où
line,
la
and the
capacité
other one
sera
shows
insuffisante.
another plausible and
Dans ces deux scénarios, les
alternative in
mesures ont
which
été
capacity
levées
could be
et
overwhelmed.
pointillées
In both
verticales bleues
scenarios, measures
lorsque
are lifted,
20% des
the
Canadiens
vertical
ont
blue
reçu leur
dashed line,
seconde dose.
when
Ce
20% of
modèle nous
Canadians
donne
have
de
received their
l'espoir,
second dose of
illustrant qu'il
vaccine.
existe un moyen
These models
sécuritaire
give
de
us
lever
hope,
les mesures de santé
illustrating
publique
that there
les
is a
plus
safe way to
restrictives
lift the
comme les
most
fermetures des lieux
restrictive
de
public
travail
health
et
measures,
d'entreprises
such
d'ici
as
cet
certain
été si
workplace and
suffisamment de
business
personnes se
closures,
font
by
vacciner.
this summer if
Dans le
enough
cas de
people get
scénarios plausibles
vaccinated.
où les mesures
In the
peuvent être
plausible
levées en
safe
toute
lifting
sécurité,
scenario,
si
if
suffisamment de
enough
personnes
people
se
get
font vacciner
vaccinated
et en
and
plus du monde que
assuming
la
vaccine
vaccination se
rollout
déroule comme
proceeds as
prévu,
planned
d'ici le
by
milieu de
midsummer,
l'été,
at
au
least
moins
75%
75% des
adults
adultes âgés de
aged
18 ans
17
et
or
plus
aged
auront
18 years
reçu
and
une
older
première
will have
dose et
received a
20%
first
auront
dose
reçu une
and
deuxième dose.
20% will have
À ce
received their
moment,
second
les
dose.
mesures restrictives
At this
pourront
point,
commencer à
restrictive
être
measures can
graduellement
gradually be
levées
eased
dans la mesure où une
as
capacité
long as
adéquate de
adequate
dépistage,
test,
de suivi
trace, and
et
isolate
d'isolement est
capacity
maintenue
and
et
individual
précautions
precautions are
individuelles
maintained.
continuent à être prises. Le scénario
The
alternatif
alternative
présume une
scenario
acceptation du vaccin
assumes
plus
a
faible.
lower vaccine
Dans le cadre
uptake.
de ce scénario,
In this
seulement
scenario, only
55% des adultes
55%
admissibles
of
ont reçu
eligible
une première dose
adults
et 20%
have
une
received
deuxième
their
dose
first
d'ici
dose
le
of
milieu
vaccine
de
and
l'été.
20% with a second
Même si
dose by
l'approvisionnement et le
midsummer.
calendrier de vaccination sont les mêmes
Despite
que dans le
the
scénario
same supply
précédent,
and schedule of
dans ce
vaccine
cas,
rollout
la
as in the
levée des
previous
restrictions
scenario.
d'ici le milieu
In
de
this
l'été
case, lifting
entraînerait
restrictions by
une
midsummer
résurgence
would
de
result
l'épidémie plus
in
forte
a
que jamais
resurgence
et la
of the epidemic,
santé
and
serait
this would
dépassée d'ici
overwhelm the
l'automne.
healthcare
Ces
system
modèles
capacity
démontrent
by the fall.
qu'il est
These
essentiel
models
d'atteindre un taux
demonstrate that
élevé
achieving
d'acceptation du
a
vaccin.
high vaccine
Plus de
uptake
gens
is
se feront
crucial.
vacciner,
The
plus
more
il sera
people get
sécuritaire de
vaccinated,
lever les
the
mesures de
safer it
santé
will
publique
be to lift
restrictives.
restrictive
C'est
public
pourquoi il
health
est
measures.
très important de se
That is why
relever les
it is
manches
so
et de se
important
faire
to roll
vacciner.
up our sleeves and get vaccinated.
Slide 14. While modeling can give us targets for planning, jurisdictions will make decisions about lifting restrictive public health measures based on data and their own local circumstances. There are many factors that will influence when it will be safe to lift the most restrictive public health measures and allow us to gather with our families and friends and increase social and economic activities with core prevention measures in place. For example, vaccines continue to be highly effective. Spread, including variants of concern, is well controlled. Public health is able to effectively test and trace, and hospitals and ICU capacity is adequate.
Diapositive 14.
Slide 14. While modeling can give us targets for planning, jurisdictions will make decisions about lifting restrictive public health measures based on data and their own local circumstances. There are many factors that will influence when it will be safe to lift the most restrictive public health measures and allow us to gather with our families and friends and increase social and economic activities with core preventive measures in place. For example, vaccines will continue to be highly effective. The spread, including that of variants of concern, is well controlled. Public health is able to effectively test and trace, and hospitals and ICUs capacity is adequate.
Slide 15. Vaccines can help lead us out of this pandemic, and we can all contribute to their success by getting vaccinated as soon as it's your turn, supporting others to get vaccinated when it is their turn, following public health advice, and keeping up with wash, mask, and space.
Diapositive 15.
Slide 15. Vaccines can help lead us out of this pandemic, and we can all contribute to their success by getting vaccinated as soon as it's your turn, supporting others to get vaccinated when it is their turn, following public health advice, and keeping up with wash, mask, and space. Thank you.
Thank you, doctors. We will now open the telephone line to questions. We ask that you limit yourself to one question and only one follow-up. Donc, une question et une question de suivi.
One question, one follow-up only. We'll start with the first question on the phone.
Operator, Mathieu.
Thank you. Merci. Please press star one at this time to ask a question. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. La première question est de...
The first question is from Christian Noël from Radio-Canada. The mic is yours. Good morning. We can see a decrease of the RT rate. There are provinces where that's increasing and other provinces where it decreases. Why, at the national level, is the rate decreasing? I may have not understood the question clearly because the sound was problematic. It's on slide 2. The national RT value went below 1. It does increase in some provinces, but it decreases in others. To what do you attribute the fact that we've gone below 1? It's difficult to speak about the national level because the RT is a description of the situation in all provinces and territories together. We know that the context, the situation, the epidemiology is different from one region to another. So, in my opinion, what's most important is what's happening in the provinces and territories, and even at the local scale. If we're talking about the national level, the RT is more influenced by the larger provinces, the provinces with the highest populations. But I think it's important to follow what is going in each region, each province and territory. But we can say that at least on the national level, it's good news that the RT is below 1. But I think it's more important to see what's happening in the individual provinces and territories. Because yes, it's true that if in one province the RT is above 1, that's something that's got to be followed, and they have to continue with all the public health measures and individual practices. Thank you. As a follow-up, I'd like to change how we see things. Sometimes we ask you what's the worst thing that could happen, but now I'd like to ask you, in the figures we have before us, do you see a small light of hope, spark of light, and what is it? For me, there are 2 reasons to be hopeful. We are starting to see that provinces and territories and at the local level, they have implemented public health measures And sometimes that's because of an increase in the number of cases. But now we see good results. We can see that the number of rates of infection are going down, and also the rates of hospitalization. These can be indicators. We're hoping that other indicators will decrease in the next weeks. So that's a good lesson, because we saw even in the north that if we have the beginning of an outbreak or a few cases, if the public health authorities put into place the right public health measures, the right restrictions, and with a population that's really aware of what's going on, and they take individual precautions, we can react, and that's good news. The other good thing is that vaccination is rolling out throughout the country. And with that, we're beginning to see the results with people 80 years and up, because it's really that high-risk group where we saw what happened in their first and second wave. And now we see there's a decrease in the number of outbreaks in the long-term care homes. And we also see that other indicators for older people, the rates of infection, are also starting to go down. So that's good news. And we continue with our vaccinations throughout the country, and we're expecting to have good results with the vaccination. But as we said several times, it's not only a question of vaccination, it's also related to sufficient individual practices and good measures at the population level. We have to do 2 or 3 things all at the same time. Thank you. Thank you very much.
Thank you. The next question is from Mirika Walsh of the Globe and Mail. Your line is open.
Hi, thanks so much for taking our questions. Can you just explain a bit more the vaccination coverage that you're expressing on slide 13? Is this showing that we need the same level of public health restrictions until the fall? Am I seeing that sort of blue line properly? Or is it more that the percentages are what matters, so the 20% 2-shot, 75% 1-shot, and whenever that happens, restrictions can be lifted?
Yeah, thank you. This is a sort of new slide that we're presenting and can be a bit difficult to understand. On the graph, the blue line is represent when public health measures are lifted, that vertical dotted blue, I think, line. And that is around the time when 20% of adults have had two doses, and 75% overall of that population on that scenario on the right has taken up the vaccine. So that's the trigger for the lift. But really what we're trying to stress is that it's the data on the epi curve and the epidemiology that is going to drive a local jurisdiction to lift public health measures, but you can't do it too quickly. What that scenario is showing that if you had a high vaccine coverage, and in fact, I think on the slide deck, there's a whole set of assumptions that is sort of provided at the end of the slides, which shows that it's actually quite a complicated setup, the dynamic model. You have to account for the spread of the virus, such as the variants, for example, being more transmissible. Some of them are more serious in terms of hospitalizations. You're inputting various levels of vaccine effectiveness, and after 1 dose, after 2 doses, and so the vaccination period is in that sort of, I guess, purple or blue zone. That sort of you see in the middle of the graph is the period of vaccination. So at the point when 20% of the adult population has had 2 doses and 75% overall has had vaccine, if you lift it at around that point and all the other conditions and assumptions are applied, you will not get a resurgence. That's around the summer period. So, and you won't get a resurgence then if you're careful in that fall period that will overwhelm your health system. But if you had a lower vaccine coverage and you lifted your measures at around the same point in time when 20% of adults have had 2 doses, but overall only 55% have received a vaccine, and you lift the restrictive measures, you're going to get a resurgence. It's a bit complicated, but in the end, the bottom line is that we need as many people vaccinated as much as possible.
Yeah, Dr.
Okay.
New, maybe just to sort of put it a different way from how Dr. Tam said, or maybe to come from a different angle, I think with this slide, there's so many factors involved in terms of, as you say, trying to get back to sort of the world we'd love to see pre-COVID. And I think what we're focusing on here is the importance of vaccine confidence and vaccine coverage, because as we all know, the more people that are vaccinated, that helps with the overall, what we might call herd immunity. So all things being equal, if you keep the public health measures in place, people keep practicing all of their good measures, you can see that with this 20%, those are the keeners, the people that have accepted the first dose and now they're getting their second dose. But if, let's say, those maybe that large part of the population that maybe sitting on the fence or maybe is a bit hesitant, you can see what the difference is. If 75% of the population accepts that first dose compared to only 55% of the population accepting that first dose, regardless of the keeners, I would say that you go forward and get their 2 doses. That would influence it. For example, another factor we're looking at is sort of the capacity of hospitals and what might happen. So lots of things in there. And as Dr. Tam said, if you look at the appendix, lots of planning assumptions. And if any of those goes in a different direction, then of course that needs to be a sort of readjusted in terms of our modeling. But we at least wanted to show you how complex modeling is, and to just focus on sort of maybe 2 key areas: the fact that vaccination is important in terms of coverage, and also what the impact might be on hospitalization. Thank you.
Okay, and my second question is on slide 3. I know that the variant from India is not yet described as a variant of concern, but is PHAC treating it as a variant of concern given what we are seeing in India? And why isn't it being listed in your disclosures on these variants? And how would you describe the risks so far with the variant from India?
Yes, I think the bottom line is there's not enough understanding of this variant. Of course, I think India will be sort of trying to characterize it, and other countries who might have, seen introductions could have a go at looking at is it more transmissible? Is it that would it be concerning in terms of immune escape? Does it cause more severe illness? We don't know any of those parameters. There's some suggestions. So in India itself, what is really important about India is that they are in a very massive resurgence of their pandemic. And within that, they have all the variants. They have B117 driving that epidemic, but they also have spotted B1351, P1, and then this variant. Now, this variant, I think, is of interest, and we're only just sort of lifting up to that characterization from, there's lots of mutations, thousands of mutations in this virus, which is normal behavior of viruses. So when do we begin to say one variant of interest is, I think the fact that India had picked it up and as maybe is fueling in part their outbreaks in a particular area, actually, around the Delhi kind of region. That is a sort of signal that this variant could be contributing and could be significant, probably in terms of increased transmission. We don't know enough, but that's probably one parameter of interest on this variant. We don't know anything about its impact on clinical outcomes or on vaccines. So those studies will have to be done. It hasn't been classified as a variant of concern yet, partly because those parameters haven't been met. But you want to do a more precautionary approach. Let's just treat this variant of interest. if we now call it that, with some respect, I think, at this point. And we are, so even now, as it's come on the radar, we're getting our genomic databases to search for this variant. We're getting, of course, our border testing is sequencing every positive case. So we have data on this particular variant for our border testing, and provinces are now going back into their samples and their databases to search for them. So I believe British Columbia and others have been searching and has reported on some. So we are going to monitor this, but it's only just triggered right now in terms of an interest globally. And of course, we have to work with the provinces to find them. But we have detected the B1617 in Canada.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
Merci. La question
Thank you.
suivante.
The question is from Catherine Lévesque from the Canadian Press. The floor is yours. Yes, hello to both of you. I would like to come back to slide 13, which states that we might lift some restrictions this summer. But I'm wondering whether this target of 75% of adults who would need to be vaccinated, in addition to 20% of adults who will receive the second dose, would be a target that the provinces and territories have to respect before measures are lifted. I know the final decision is up to the provinces and territories, but is this an indication you are giving the provinces at this point? Thank you. Thank you for the question. This, Dr. New, as we always say, dynamic modeling is very complex, and I think it's a good tool for planning. I think that in all provinces and territories, as you saw, it's their own rollout of the vaccine that's important to try and get the highest number of Canadians getting vaccinated as quickly as possible. But we also want to emphasize the fact that it's also important for Canadians to understand that the uptake of vaccines is really important because everyone has a role to play in response to this pandemic. We can have all kinds of restrictive public health measures and all that, but vaccination is a major tool. And it's not necessarily a target, but it's always a question of examining the situation and looking at data, not necessarily as dates, but these are important figures. If we have a very high rate, so even 75% or more of the population that's accepted their first dose in every province and territory, and also 20% of people who have already had their second dose, I think that's good. I think it's more at the local level. I don't know for the whole province, because even in Ontario, there are differences in the Toronto region compared to Northern Ontario, for example. So I think those decisions must be made by local health authorities. But I think it's a good reason to encourage people throughout the country to vaccinate the greatest number of people as quickly as possible. Question, you say that it's an objective. Why is it not a target? I think it would be important to clarify that. I also have another question on page 3. There are projections and data on the different variants, and here we don't have complete data on variants since March 25th, if I read that properly. How is it that PHAC has no data on these variants, has not had any for a whole month? How can you explain that situation? Answer, thank you for the question. So, as for the other question with an objective, I think the objective is to offer vaccination to all Canadians between or by September 30th, or even saying by the end of summer. But there is a difference between offering vaccination to Canadians and the uptake. So I think that we're starting to make people aware that, yes, we will have a good vaccine supply here in Canada, but we also have to increase confidence in vaccination amongst Canadians, because it's important to have a very high rate of vaccination in order to react against the pandemic. That's the first thing. In terms of the data on variants of concern, it's always a changing issue. We're working closely with our peers in the provinces and territories, and they're very busy in the provinces and territories simply in managing the situation, in gathering all the data at the local stage, local scale, and then merging data for the provincial level. Yes, it's not ideal, but there is a bit of a delay at the federal level before we receive the data. So we continue to work on that to improve the exchange of data, the sharing of data.
Just add something, just in English, is when I'm not sure if what you're looking at is the lineage not assigned or the incomplete data. There's always a lag. To sequence genomes is actually quite a big task, and so that is, but that doesn't change how you're managing the patients or your population on the ground. Where there's lineage not assigned, is sometimes it's no longer necessary because you know what is around in your population. Sequencing every single virus is a huge effort. At the beginning, when you got a few cases, you really want to sequence them all. When you know that, the vast majority of what you're seeing and the mutations that you're seeing suggest is B117, for example, you no longer need to sort of sequence every single virus. And we don't expect that to be, a reasonable path forwards. In Ontario, for example, you've got thousands of cases which may be B117, and there's no longer expectation to just whole genome sequence every one of them. They are doing a lot of screening for the mutations, which indicate what the variant is likely to be, and that you're seeing in that red line on that graph that is being plotted. So I think we will see a shift in how the variants are reported over time, because if B117 is now our predominant virus, that's how it is. We don't have to count every single one of them.
Thank you, Dr. Tam. Just a reminder that we have 15 more minutes. We have to wrap up for 11:30. Donc, on va commencer avec la première.
So we'll continue with the next question. Operator?
Thank you. The next question is from Mackenzie Gray of CTV News. Please go ahead.
Hey there. On slide 13, talking about the vaccine doses for the summer, does this mean that public health's opinion, it will take a minimum of 75% to kind of reach the herd immunity that we've discussed? And also, Dr. Tam, you talked about the blue line where you're expecting that public health measures will be able to be eased. Can you give us some clarity on when that date is on the graph? It's just not clear here.
Well, the graph, just to say that lifting at that blue line is when 20% of the Canadians have received the second dose, as well as either 75 or 55% of adults overall have received the vaccine or accepted the vaccine. So we're going to have to see when that occurs. When I say the summer, first of all, it's based on vaccine supply. We're going to have a lot of vaccines coming up next week. There's going to be a big delivery. And so if the supplies continue as projected and everybody rolls up their sleeves, at least, in these kind of percentages, that is when you can, and you lift measures when 20% have received the second dose. It could be anywhere, from somewhere in that sort of, mid-July to August kind of time frame. But it all depends, right? I can't. But when the vaccine coverage data becomes more apparent, we'll be able to sort of see how this is trending. But that's not the only factor that goes into when you can lift. There's a list of 25 of those assumptions at the back. As I said, anything can shift this. But when we say the summer, I think that's around the sort of mid-July, August sort of timeframe. But even then, you have to be cautious and not sort of just lift everything. You're going to lift things in stages and see what happens. But that's I guess it is a bit difficult to see. Well, but it's because it's not a date. It's actually when certain milestones have been achieved.
Thanks for that, Dr. Tam. My follow-up question is about AstraZeneca. The New York Times is reporting today that the 1.5 million doses that the U.S. sent to Canada was made at the Baltimore plant, which the Biden administration has halted production there. Serious manufacturing flaws, some pretty gross conditions in which the vaccines were made there. Should Canadians be concerned if they got one of those U.S.-made AstraZeneca vaccines that the Biden administration has basically halted production in that plant?
So I think the bottom line is no. I think the regulators, Health Canada, have their measures in place. I don't know the details on your question, so we may have to follow up on that one. But as far as I understand, that what is happening in the U.S. right now does not impact us in that the vaccines that we've already received, and that's been deemed of high quality and met the regulatory standard as we received them.
Thank you, Dr. Tam. We have 10 more minutes. Operator, next question. And I'd really just remind that it's one question, one follow-up. Thank you.
Merci. La prochaine question.
Thank you. The next question is from Mélanie Marquis from La Presse. The floor is yours.
Bonjour, ma question est pour Dr.
Question.
New ou Dr.
My question
Tam.
is for Dr. New or Dr. Tam. I will be moving between two slides. Slide 19, the last one. We're being told that the model supposes a period of 4 weeks after the lifting of restrictive measures. So it talks about reopening borders. So if I'd like to understand, if I go back to slide 13, if we opened the borders a month after lifting restrictive measures, so a month after the end of July or August, there would not be a strong effect on the case rate. I'd like to understand that curve.
Excuse me, c'est Dr. New.
This is Dr. New. I'm looking at that slide as well. I think that what we have to emphasize is that there are many assumptions. So the objective with slide 13 was really showing that the uptake of vaccinations of the first dose and second dose has a certain effect on the rate of hospitalization and on the healthcare system. But as you saw, there are many, many other factors. So what we do at our borders, what happens with the effectiveness of the vaccine. So I can't give you a very precise answer because this evolves over time. So we have to look at what will happen in the next months and weeks with the vaccine rollout and also with the public health measures and the continuation, I hope, of good individual practices. So if we're talking about borders, yes, that's another factor, but I think it's really difficult to give a date or say what we'll do at a certain point in time. There are many other considerations. If we're talking about the measures that we'll be adopting or continue to practice at our borders. Teresa, do you have anything to add? Follow-up question? So I would like to hear from Dr. Tam if she wanted to add something. But on the question of borders, I'm wondering if we apply that same logic of lifting restrictive measures for Canada. So 75% of population has at least one dose. Would it mean that we could cover the borders individually according to the country, or is there a collective herd immunity that's required rather than opening to all countries at once? Is that clear? It's a rather complex question because we will see what will be happening in the United States or in other countries also. As Dr. New said, it will depend on the uptake of vaccination. And also, there will be children who have not yet been vaccinated. So there will be cases, that's certain. So we have to remain vigilant because there will be other variants, for example. So it depends. We will have the rate of infection, and then there'd be that relaxing of the measures, which will have to happen very gradually.
There would probably be an expectation that the domestic epidemiology is well under control as international borders ease. So I think, but that is a very significant discussion ahead. But it will really, give us a lot of hope. The last thing I would say, look at the vaccination rate in the territories. Some of them have got to over 70% already, and many of them have now began their second dose. I think, whether you go for a single number or not, strive for, let's just say, can you be as good as the territories and keep going until you're as good as them for now, and then see what happens to the epidemiology. So kudos to them, and I expect everyone to strive for high levels of vaccination.
Thank you, Dr. Tam. We have time for one very quick question, one last question. Operator, next question.
Thank you. The last question is from David Turton of CBC News. Please go ahead. Your line is open.
Hi, thanks for taking this question. Slide 13 is very fascinating, but I'm just wondering how optimistic we should be about the orange scenario, the scenario where, 75% of Canadians have one dose, 20% have two doses. Because if you look at the weight of hospitalizations, we're still on track, even with that scenario, to see a bit of a wave in hospitalizations in the fall of this year. And that, just looking at the line, seems about where we're at right now. And we're under, some pretty severe restrictions depending on where you live in this country. So I'm just wondering, how optimistic should we be about the orange scenario that you're showing in slide 13? It doesn't seem to me to say that we're out of the woods yet. I'm wondering if you can just kind of give us your take on that.
Yes, and I think we do need to be very cautious. This, as I said, has lots of assumptions built into the model. But what I would say is these are vaccines. You can look at it at the population level, but they're extremely good at preventing serious outcomes. So for the individual, preventing hospitalizations, ICU admissions, and deaths is really, really important. So don't just look at it as a population basis, but if everyone got vaccinated, you're going to get reduced hospitalizations and serious outcomes because of just how effective these vaccines are at the moment. Of course, if a variant shifts the vaccine effectiveness, that can be an issue. But you're pointing at a really good point, which is there's uncertainties in the scenarios. That's why we provide a range. And we will just keep coming back to these models and see how we track, I think, is the best I could say. But you're right. I mean, even in the black line that you see, there's shadows behind that. It shows the range at which range of patients that could still hit the hospitals over that time frame. So the other thing is, in a population model, when you're lifting at 20%, we don't want people to just only 20% of people get the second dose. Everyone has to get the second dose. That is really important for individual protection over the longer term. It is very important. So don't think that our goal is somehow to have 75% of people vaccinated and only 20% get the second dose. Everybody has to get it.
Thank you. Follow up?
Yeah, I'll just ask you quickly. What is your advice to pregnant women about getting the vaccine? What should they be doing right now?
So it's a great question. So first of all, I think pregnant women should have a follow-up, of course, and have this conversation if they need to with their individual healthcare provider. What you're trying to look at is a balance of benefits and risks. For the vaccine clinical trials didn't include pregnant women, certainly these initial clinical trials, but there's no biological reason why the vaccine wouldn't be effective and safe during pregnancy. And the Society of Obstetricians and Gynecologists of Canada actually recommends that these vaccines should be provided to pregnant women after a discussion with the physician. The National Advisory Committee on Immunization has also said, look, we know that the clinical trials didn't include this group, but you should offer it based on a individual conversation. But what I would say to women who are pregnant is that we are seeing higher risks of severe outcomes for pregnant women, during pregnancy from COVID-19. And we are also seeing ICU admissions more recently associated with this current resurgence. So I think that if you look at that risk and benefit balance, you should, I think, in my mind, in general, the benefits would outweigh the risk, but have a look at your local situation. The other thing is that talk to your physician in terms of which trimester of pregnancy, and look at the Society of Obstetrician and Gynecologist advice as well. Those are credible sources of information, and you should sort of read up on it, and that should help you make your decision.
Thank you, Dr. Tam. C'est ce qui met fin à la conférence de presse pour aujourd'hui.
This concludes our press conference.